Okay. Well, thank you so much for having me. As Nisi mentioned, my name's Dusty Olson. I use she, her pronouns. I am a HUD technical assistance provider with ACT Global, and I am your community's regional team point of contact, which is your assigned HUD technical assistance provider. Every community CoC in the country has one to be able to support you and answer questions and work with you on projects. I'm going to ask for a tiny bit of grace from y'all today. I am not feeling very good, but I didn't want to cancel on you because I knew how hard it was to get this on the schedule. So hopefully the cold medicine kicks in and doesn't make me too drowsy, and we can get through this. I've been a HUD technical assistance provider for 4 years, and I've been assigned to your community for about 3 years now. So I've had the opportunity to work with you for a while. And I support, in addition to a lot of other projects, I support 7 communities in Michigan. So I am also supporting a fair number of your neighboring CoCs. And so I'm very familiar with kind of how the homeless response system is set up across the state of Michigan as well. So what I'm here to talk with you about today is the rules and regulations that govern your work as a continuum of care. And from HUD's perspective, their expectations and their requirements that you need to meet as a CoC. I'm going to start first with some historical context for you. But I don't ever talk about HUD without acknowledging that HUD uses a lot of acronyms. And sometimes we get going and we just are talking in them because this is like our language. And a fair part of what I do in my job, honestly, sometimes I think is translate HUD speak to other people. But if I get going and I use an acronym you are not aware of, I will try to always remember to say what it is. But if I don't, please feel free to come off mute, to stop me, to ask for clarification in the chat, or to just stop and ask. But I'm going to go over the really important ones that we definitely will talk about at some point during this presentation. So HUD itself is an acronym. It stands for the Department of Housing and Urban Development. I don't think I ever say that full out unless I am talking to somebody who I know doesn't know anything about homelessness. Then I will say the whole thing, but for the most part, we just use HUD. And then the majority of homelessness funding and guidance comes from the Division of Special Needs Assistance Program, the SNAPS office within HUD. So HUD has multiple divisions, but most of the homeless intervention flows through the SNAPS office. There are some other funding sources and guidance that comes from HUD for things like vouchers or other types of community development funding that can be used for homelessness, but dedicated homelessness money flows almost entirely through SNAPS. The other thing that we will talk about is the HARTH Act. HARTH stands for Homeless Emergency Assistance and Rapid Transition to Housing Act. I'd been in this work a very long time before I even knew that HARTH stood for something. I thought it was sort of like a cute reference to like hearth and home. I didn't actually realize that HARTH was an acronym, and that I just noticed there's a spelling mistake on the slide. It's not heart, it's hearth with a TH, that it actually was an acronym. The CoC is what we're here to talk about today. CoC stands for Continuum of Care, but that's kind of a mouthful, so we almost always shorten that to CoC. We will talk a little bit about your HMIS system, which is your Homeless Management and Information System, which is the required database that HUD mandates that all CoCs use for their program and client level information. We will talk some about your Emergency Solutions Grant. That is not dedicated to the CoC, but it needs to align with CoC funding. And we'll talk a little bit about who has ESG funding within your community. I will talk briefly about some of the federal ports, two of them being the PIT count, which stands for point in time, and the HIC count, which is the partner to that stands for housing inventory count. And I will also talk a little bit about the NOFO. The NOFO is the Notice of Funding Opportunity, and that is the annual competition that HUD puts out for your continuum of care funding. So as I go through, like I said, I will try to remember not to use just the acronyms, but if at any point you don't know what I'm talking about, please feel free to stop me. Okay. The first federal homelessness legislation was the McKinney-Vento Act of 1987, which really was not that long ago, right? Like that's late 80s. So that's definitely not that long ago, even though it's starting to feel a little bit like a long time ago. But we still operate under the McKinney-Vento Act. That is still legislation that is in place. And the CoC funding comes from the McKinney-Vento funding through the congressional budget. In 2009, the HARF Act was enacted. That was an amendment to the McKinney-Vento Act, so it made some changes. As you can imagine, right, there were some fairly substantial changes in the way we approached homelessness between 1987 and 2009. In 2009, the CoC was outlined in the HARF Act, but it is HUD's standard practice to then interpret legislation into a rule. And so it took 3 years for HUD to interpret the HARF Act into the CoC program interim rule, which was published in July of 2012. And that implements the HARF Act. It establishes the regulations for the CoC, and it applies to every CoC funded project, new or renewal, since that time in 2012. We are still operating today under the 2012 interim rule. It was never finalized, because once a rule is finalized, when you want to make changes to it, then you have to go through Congress to do that, which is not an easy process. So it still remains an interim rule, but it is still the operational pieces that we work under today. So most of this presentation comes from guidance that it lives within the interim rule. However, we've made a lot of changes to what we do in homelessness since 2012. So just because we are still operating under the interim rule does not mean that HUD does not have some leeway to set specific policies and strategies and priorities, and they do that through the Notice of Funding Opportunity. A great example of this is when I first got into this work, transitional housing was the thing that we did. Lots of funding was in place for transitional housing. Now, HUD does not fund any new transitional housing programs unless they are for youth and young adults or domestic violence survivors, right? They have made that policy shift through their funding opportunity rather than changes to the interim rule. However, we are hearing that HUD intends to open the interim rule sometime soon. Soon is a relative term, right? It took them 3 years to write the original interim rule from the time of the legislation. So soon, not sure when soon will be, but they do intend to open the interim rule to public comment to make some changes. So we're here today to talk about the CoC. So on its face, the CoC is a convening and planning body for a set geographic area that is responsible for carrying out and implementing the requirements that are laid out in the legislation within the interim rule. A community gets to define what the geographic area for their CoC is. The vast bulk of CoCs, there are about 330 in the country, the vast bulk of them match very much to what your CoC is, which is a county. A single county is the geographic area that is defined as the CoC. It can be a single city. Detroit is its very own CoC, and Wayne County, where it is in, right, Wayne Metro, is a separate CoC. Some CoCs are entire states. So each community gets to define that for themselves. And what you'll see as we go through this is that is true of a lot of things. HUD left a lot of things up to community interpretation and development simply because we are a very, very large country, right, with very different resources, very different geography, very different sets of problems, very different populations, right? It didn't necessarily make sense to mandate how you do a lot of this. So as we go through, what you'll see is HUD tells you what to do a lot, but how you do it is really up to you, starting with what is the geographic area that is your CoC. As we go through this, what you will see is there are a lot of administrative requirements to be a CoC. And it really can be a situation where you could check all the boxes and really have it be a lot of busy work and administration without a lot of positive impact. That is not the purpose at all. It is not designed to be busy work. It is designed that when you do all of these things effectively and you weave them together in a solid way with specific intention and vision and direction for your homeless system, that completing all of these requirements serves as the infrastructure for a highly functioning system to respond to homelessness. The CoC is in place to promote a community-wide commitment and coordinated funding to end homelessness, including clear and consistent strategies to achieve that goal. So the CoC does serve as a source of funding for efforts. You receive money as a CoC from HUD, but in nearly every community in the country, it is not the only money that is being used to resolve homelessness. And in some communities, it's not even the largest pot of money. I live in the Seattle area. We have much more state and local funding in homelessness than we have CoC funding, for example. But in your community, right, it is a much larger percentage of that. But the idea being that everybody comes together and develops a unified vision for how you're going to respond to homelessness, and ideally braids all of that funding together so that it is working towards a common goal using similar strategies regardless of funding source. And the intention is to ensure that the services that are available in your community are effective and they are meeting the needs, the unique needs of people experiencing homelessness in your community, right? And so we want to make sure that the programs are available and they are the right programs for your community and they are working effectively for people who are experiencing homelessness in your community. Okay, I'm going to talk a little bit about who is generally involved in the CoC within the main roles that we have in the community. Excuse me. So what you'll see here on the top of the slide are 5 specific roles. Those roles are defined by HUD. That you have to define these roles. HUD requires that you define these roles. The bottom 2 are not defined in the same way within the interim role, but they have significant roles within your system. So I'm going to start with the membership, and I start with the membership very intentionally. Most of the time in a community, when we say CoC, what they usually reference is the board, right? Or what you call in your community your governance council. That's what people usually mean when they say CoC. That's what comes to mind. But in fact, the CoC is a membership organization that should be much broader than your board. So the CoC is established by representatives of relevant organizations within your geographic area that you've defined, so within your county, to carry out the responsibilities that the interim rule requires. And that membership should demonstrate a community-wide commitment to ending and preventing homelessness. But what that membership looks like is not defined by HUD. They require that you define what a member is and how you obtain membership in the CoC. And they give you suggestions of who should be involved. Some are stronger suggestions than others, but you get to define that. So for example, there's universities on this list. The CoC that I live in, right? I worked in Seattle, but I don't live in that county. The CoC that I live in, we don't have a university, right? So we're not going to have university in our CoC. That doesn't make sense. But we do have like multiple hospitals, right? And so, those are involved. So it's not defined like who should be part of it. It needs to make sense for your community. But generally, it consists of all of your homeless service providers, victim services providers, other social services and faith-based organizations and government organizations that touch the homeless system or are adjacent to the homeless system. Often law enforcement, affordable housing, organizations that serve veterans, organizations that serve youth, sometimes advocacy organizations like for specific populations that are overrepresented in homelessness, like LGBTQ populations, or like Urban League. It really depends on your specific community what your membership is made of. But basically, you want to ensure that it is a representative group of your community and that everybody who is coming to the table is participating in the development of that unified and coordinated strategy to respond to homelessness. Now, I've pulled out some specific things in your charter that outline kind of where you are at currently for your structures. So in your charter, you define your membership as being open to anybody who is interested in addressing homelessness within your community. You have 2 different levels of membership. That's fairly standard. And you define sort of what comes with being a member. You also have in your charter, which is slightly different, not all communities have this type of membership expectation, but you also define what the expectations are for an individual to be a member in good standing by their meeting attendance and participation in a committee. And that is what gives a member the right to vote within your CoC. This is one of the things, excuse me, I've got a hair in my mouth. This is one of the things that HUD says you have to do, right? You have to define your membership, but you have the right to define that however you want. You have defined it fairly strictly. Some communities defined it really kind of going back to the first bullet on this slide that you have, that like basically anybody who wants to be a member can be a member, and that is how they define it. Right? You've gone on to define it more with levels of membership and membership expectations. Okay, now I'm going to talk about the governing board, or what you call the governance council. The, oh, goodness. The governance council, or the governing board as HUD defines it, is a subset of your CoC membership, right? And so it also needs to be representative of relevant organizations and projects and the homelessness subpopulations that you see in your community, right? Representation is what your membership and your board should be about. HUD requires that your governing board include at least one individual who is currently or has previously experienced homelessness. You have to have a process that is defined in writing for the selection of your board members, and that must include term limits. So you can't have the same people on your board in perpetuity. You have to have a process that is reviewed, updated, and approved by the CoC at least once every 5 years for how you are going to select your governing board. And you want the representation to be inclusive and consistent with community demographics and populations of persons experiencing homelessness within your community. So if you look at the racial and gender and age demographics of people experiencing homelessness in Genesee County, and that doesn't look anything like who is sitting on your board, right? Then your board is not representative, even if it is representative of all of the organizations. So it's really about multiple different perspectives of representation. The responsibilities of the board vary considerably as to how things get implemented, but there are some HUD expectations for the things that your board is required to do. In honesty, the board is really the place where the buck stops here, right? The board is ultimately responsible because the membership has selected them to represent and act on behalf of the CoC. even if the board designates a lot of responsibilities to another entity, whether that is your collaborative applicant or a committee or your HMIS lead, all of which we're going to talk about, it ultimately is still the board's responsibility to make sure that everything that you are obligated to be doing as part of being a CoC is in fact happening. So the board is the main decision-making body for the CoC. It oversees all of the work. It establishes committees and work groups, which is where most of the work happens. So the board isn't necessarily doing all of the work itself. And in fact, in most communities, it's not effective for the board to be the only entity doing the work. But the board has the option and is the only way that a CoC can establish committees and work groups. The board is responsible for setting the CoC goals and priorities. It is responsible for approving written standards for programs, and I'll talk more about those later. It approves your CoC project applications. It approves your CoC policies and procedures for coordinated entry, and it evaluates your system's roles and functions, all of which I will talk about when we get into responsibilities shortly. So your governance council, this is what your charter says. Your governance council is in place to work collaboratively with the infrastructure organization to provide leadership and oversight to ensure the CoC carries out its mission and meets all funding mandates and requirements. You define your governance council as having 25 to 31 members. I will share that as a very large governance council for a community your size, but you have the ability to define that however you want. You have expectations for participation on your governance council, and you specifically lay out your desire for representation and your term limits, which is a required element. Your governance council has 9 designated voting seats, 3 designated ex officio seats, non-voting seats, and 19 undesignated seats. So the designated seats are for education, government, and housing. And then you have non-voting seats for your infrastructure organization, HMIS, and your HARA. And your charter lays out the responsibilities of your governance council to provide leadership and oversight, to recommend annual goals and objectives, to ensure community communication and awareness building, oversight of grants, project and performance, voting on strategically focused matters, making recommendations to the membership as specified in the charter, reviewing information from the infrastructure organization regarding membership and participation, working with the infrastructure organization to ensure that all of the administrative functions are being met, and preparing recommendations for members of the independent review team, which is one of your committees, and authority to issue letters of support. So these are the things that you have specifically outlined as the responsibilities of your governance council. The next role that HUD defines is your collaborative applicant. Most CoCs are not a structured entity. They are a group of interested parties that are coming together. And so in order to be able to apply for and receive federal funding, there has to be an entity that is eligible to receive federal funding that applies and functions in that role on behalf of the CoC, and that is the collaborative applicant. The collaborative applicant compiles and submits the annual application to HUD for CoC program funds. It also can apply for the CoC planning funds. I'll talk about both those things in more detail later. It is required that your collaborative applicant participate in the development of the governance charter. And you could designate any other responsibilities to the collaborative applicant that you want as a community. That just has to be outlined in your charter. Often the collaborative applicant serves as the lead agency for staff support for all CoC functions, but not always. So in your community, right, you have what you are designating as your infrastructure organization, which is what you call your collaborative applicant. And your infrastructure organization has all of the responsibilities of the collaborative applicant and then some, because it does in fact serve as the lead agency that your CoC staff are employed by. So current your collaborative applicant is the Greater Flint Health Coalition, and you have indicated in your charter that the infrastructure organization and the collaborative applicant can be the same entity, but it does not indicate that they have to be the same entity. But because you designate an infrastructure organization, it probably makes the most sense that it is the same entity, but it doesn't have to be under HUD's guidance or under your charter even. The planning grant is dedicated funding that comes into a CoC that is separate from the services money, that is specifically available for the collaborative applicant to support all of the required elements of being and running a CoC. The planning grant can pay for any of the required activities that a CoC has. But the reality is that most of these requirements, like doing the application to HUD and evaluating your programs and working on your consolidated plan and conducting the point in time count. The reality is that for most of these required responsibilities, the only cost, or the only substantial cost anyway, is staff time to do them, right? And so the vast bulk of communities use their planning grant to pay for staff to operate the CoC. In some communities, that's a half-time person. In some communities, it's 3 or 4 people. That just depends on how much money you have available to you. I will tell you, there's not a community in the country whose planning grant pays for the full 3 or 4 people. So CoCs that have more staff employed as CoC staff are utilizing funding from multiple different sources to pay for that. But the planning grant is the primary way that CoCs pay for the time necessary to accomplish most of these responsibilities. The next role is your HMIS lead. The HMIS lead is the entity or agency which manages a CoC's homeless management information system, which is your database system. The CoC retains, and under the structure of the governance council, the authority and responsibility for HMIS, but they designate that responsibility to the HMIS lead to be able to effectively implement HMIS, right? Because you can't usually operate something like a data system with 20 people that are your board trying to do that. So there is an HMIS lead that is designated by the board that is responsible for the administration and management and operation, as well as user training and doing your federal reporting requirements that all come out of HMIS. So your HMIS lead in your CoC is Metro Community Development Organization, and in your charter, it maintains that they are responsible for maintaining HMIS within HUD's compliance. They are responsible for developing data standards, a data privacy plan, and a data security plan, for training HMIS participating organizations, for ensuring participation of recipients and subrecipients, right? That all of your funded programs are participating in HMIS, that they are in compliance with your policies and procedures for HMIS, that they are submitting your reports, your federal reports, and any other required funder reports, if you have state or local level reports that are required as a result of receiving funding. They can seek an HMIS grant to be able to support this work and administer that money. They are generally partially responsible. In your charter, you indicate that they are responsible for the point in time count, for helping with monitoring recipient and subrecipient compliance with HUD regulations, and for evaluating outcomes that are funded through your CoC and ESG programs. This is pretty typical. These are pretty consistent with standard HMIS lead responsibilities. One thing that you do have in Michigan that is different than most places is you have a statewide HMIS implementation. So your community does not get to pick the HMIS system that you are using. That is something that is was selected at the state level, and all of your programs across the state of Michigan use the same HMIS, and you have HMIS support from the state as well. That is significantly different than most communities where each CoC selects their own. The next role within the CoC are CoC committees. It is impossible, right, for the board and the staff to do all of the work that the CoC requires. And it really is not, no matter how good of a representative board you get, right, that's usually a very small percentage of people that are actively involved in your homeless system. And so CoC committees really allow the work to be spread amongst more participants for greater perspective, for more inclusive involvement, and really just to ensure that the work is done more effectively than a very small number of people having to do everything. So CoCs have committees that really can manage the activities as long as they understand what they are supposed to be doing and their authority for when they can make decisions and implement changes. So the board can designate a committee that has full responsibility to do something, or it can say, you go put this plan together and then the board has to approve it, right? You can make decisions within your community about what the authority that you want to designate to committees is. There is no guidance on what your committees have to be. It is pretty typical for there to be some type of governance committee, executive committee, somebody that is like a smaller group, even a subset usually of your board, that is kind of responsible for the day-to-day operations. It's fairly common for there to be a committee that is looking at performance or HMIS data. You might have a committee dedicated to lived experience. You might have a committee dedicated to your project application, but you can decide what these are and how they look. And then you can also have ad hoc or short-term committees to do specific functions. So you have laid out within your charter an executive committee, which is the subset of your governance council, an advisory committee, an independent review team, which is serving as your funding review process for your rating and ranking, as well as some other funding decisions that happen, your nominating committee, which is really about the selection of your governance council. You have a fiscal oversight committee, which is to review your grants and spending. You have an interagency service team, which is really about your clients on your by name list related to coordinated entry. You have an analysis and planning committee, which is really looking at the strategic work that you do, community engagement, focusing on outreach, justice and advocacy, and system infrastructure, which is the HMIS administrator oversight. So these are the committees that you outline as permanent function committees within your charter. So those are the roles that are defined by HUD. HUD says you have to have a membership definition, you have to have a governing board, you have to have an HMIS lead, you have to have a collaborative applicant. This next role of the CoC staff is not defined by HUD in any way. But the reality is you could not do all of this stuff if you do not have people whose dedicated job it is to do that. So most CoCs have a staff role. The staff role is generally responsible for management of the meetings and the calendar and the agendas and the minutes and the attendance and all of the things that are necessary to document the operations of the CoC. It is generally the staff's responsibility to stay aware of HUD priorities, requirements, develop relationships within the CoC, communicate across the CoC, and really be the coordination of this work. Generally, in my role as a technical assistance provider, the staff for the CoC is who I am predominantly engaged with. And in fact, I meet monthly with the staff for all of my CoCs to answer their questions, to provide updates from HUD. to see if there's any support that they're needed, and really kind of work to serve as a liaison between HUD and the staff, and then the staff's responsibility is to communicate that to whoever within the CoC needs that. So you have designated the infrastructure organization as your CoC staff entity, right? This is something that you've defined in your charter. This is unique to your CoC. Most CoCs do not have something like this designated in their charter. Most CoCs just roll this into either their collaborative applicant or some other entity, but they don't have a specific name for it. But I would say 90+% of CoCs, this is the role of their collaborative applicant as well. So your infrastructure organizational responsibilities in your charter overlap somewhat with your collaborative applicant around supporting the mission to end homelessness, and then access to programs. But it's really about coordinating the work of the CoC, providing training and technical assistance, conducting the meetings, developing the agendas, all of those things that I talked about. You also indicate that the infrastructure organization is to define the roles and responsibilities of the key partners within your system, to maintain group processes, to respond to requests from the governance council and committees, to coordinate grants, to assess the performance of the community's strategic plan, to provide information and data to the community, grant and program monitoring, fiscal management, and conducting required environmental reviews. That last piece around conducting required environmental reviews is highly unusual. Generally, it is your government entity that does that as the recipient usually of your ESG funding. So how do all these roles fit together? I've talked about all of these roles. They don't fit together in any specific way. HUD does not define that. So you get to define how they fit together and who makes sense to take on all of the responsibilities to ensure that the obligations are met and all of the activities are happening. So you can, we're going to talk about responsibilities. Authority to execute any of these responsibilities that we're going to talk about can be delegated to your board, to a committee, to a work group, to the collaborative applicant, or your infrastructure organization, to your HMIS lead, right? You decide as a community who it is and how it is that all of the rest of these things are getting done. And you are just required to outline those in your governance charter. And additionally, it is a best practice to have MOUs that further define the relationship between the partners, because in general, I don't suggest that your governance charter like name out specific organizations, because then if those change, you have to change everything in your governance charter, which is kind of a pain. But you can reference the name, the functional role of the entity without referencing the name of the agency, and the MOU then is between the agency and the CoC board that indicates that that agency is taking on that role. Okay, before I jump to responsibilities, let me look and see if there are any questions in the chat.
I think they're primarily around, can you share the slides with us and then we can push it out to the community? Is that something we can do? Okay, perfect.
Yes, we'll definitely do that. Okay. Any questions that anybody has at this point? Okay, I know I'm going very fast, but that's to get us through in time. And as we go through this next section, things will coalesce a little bit as we talk about responsibilities. So I started out by talking about who are the key entities, who are the key players within the CoC, and now I'm going to talk a little bit about what are you required to do, the responsibilities and requirements. There are 4 buckets of responsibilities that the CoC has: operations, system planning, data management, and CoC funding application. So we're going to start with CoC operations. And this is really about the administration and functional operation of the CoC and how you work together, and what you are agreeing to as community partners coming together to respond to homelessness. So as I mentioned back when I talked about membership, right, the CoC is the membership, right? The membership is the sort of full entity of the CoC, and they select the board or the governance council in your community to act on their behalf. How you define membership, right, is unique to your community. You are required to outline what constitutes a member in your governance charter, which I already showed you that you do. You are required to hold at least 2 membership meetings annually. And this looks very different in different communities. In some communities, every single meeting of the board is considered to be a membership meeting, and they have multiple membership meetings a year. Sometimes they have 12, right? In other communities, the board meetings are board meetings and the membership meetings are completely separate. And they might be like 2 half-day meetings a year where there's training and things that are really specific to doing the work of the CoC and providing, the homeless response system in a way that is more meaningful to people participating on the ground than a lot of the things in the board meetings might be. Neither of those are right or wrong. You can do it either way. Your community leans much more towards the first one, where all members are invited to the board meetings, and there are lots of both board activities like votes and discussions around like the administration of the CoC, as well as talking about community services, for example, or providing updates that members need to be aware of. You are required by HUD to identify and invite new members to participate in the CoC annually. That can be very informal, like just a CoC listserv where it says, hey, if you haven't participated, please start coming to meetings. Or if you're looking at your membership and you realize there's a perspective that is pretty important in your community, it's not there, and it can be targeted recruitment. Probably should be a combination of both. So to operate your CoC, HUD requires that you adopt and follow a written process to select your board to act on behalf of the continuum of care. This process must be reviewed, updated, and approved by the CoC at least once every 5 years. In your charter, you outline that the nominating committee is responsible for the development of the nominees for your governance council, and proposes those nominees to the board and your full membership with every annual governance council election. You are also required to document the operations of the board through meeting minutes. And whether those happen at committees or at the board, you are required to be able to show HUD, if they come to audit you, that you are meeting all of these responsibilities. And generally, the board meeting minutes are where you can show that you did that. It is where you can show that you had a discussion of rating and ranking and what your NOFA funding process looked like. And it's where you can show how your board elections happened and when they happened, right? And if things are designated to committees, there may not be the same type of notes from a committee, but you would need to have a report, for example, from the committee to the board that shows that they did in fact, conduct the point in time count, for example, because HUD does come and monitor to make sure that your CoC is meeting its requirements. Not very often, but they do. I have referenced the governance charter a bunch of times, and I always think about, like, sometimes I'd like to start with this slide very first because I talk about the governance charter all the way through. But the governance charter is a system operation function that you are required to have. It is essentially the how you are agreeing to work together. So you want to think about it as your blueprint for how your CoC works. I've said multiple times, right, that HUD tells you you have to do something. They do not tell you how you have to do it. Your governance charter outlines how you are going to do it and how you have agreed to do it as a community. Your governance charter has to include policies and procedures to carry out the CoC responsibilities, either directly or by reference. I almost always recommend that is by reference because you want your policies and procedures to be a little more flexible than your governance charter is. But for example, you are required to have CoC policies, or coordinated entry policies. That's actually the next slide. So you would reference like how the coordinated entry policies get developed and who's responsible for developing them and approving them in your charter. But the actual policies of like, here's how often we're going to have a by name list meeting, right? Those don't live in your charter. You just reference them. You are required to have a code of conduct in your charter. You are required to have a conflict of interest and recusal process for board members or any other member of the CoC that is participating in funding decisions. And you are required to have a process for amending your charter. HUD requires that you review your charter annually. That could be as simple as having that be an agenda item on, the board meeting every March of the year, where the agenda item is our governance charter still up to date? Is it still how we function? Is it still how we want to function? Yes, good, check, we did that for the year. But you are required to go through a more extensive process, at least every 5 years, where your entire CoC membership agrees to adopt the existing governance charter and votes to do that. But anytime you make a substantial change to your charter, you have to go through the process of having your entire membership adopt it again. So you may not make any changes every 5 years, but anytime you do make changes, and at least every 5 years, your membership needs to adopt your charter. You are required to establish and operate coordinated entry, and that is required to be in consultation with your ESG recipients. So ESG stands for Emergency Solutions Grant, remember, and that comes in generally to your jurisdictions. I'm going to talk a little bit more about that in a minute. But ESG and CoC funding both come out of the SNAP's office. So they are very well aligned because they fund very similar things to have very similar requirements, so that they are pretty much forced to be working in unison within your community. So both CoC and ESG funded projects are required to receive their client referrals from coordinated entry. So your coordinated entry system needs to be designed by your CoC in cooperation with your ESG recipient. Your coordinated entry has to have a assessment process. It has to have a consistent way to manage your housing resources. It has to be accessible and well advertised within your CoC. Another unique thing to Michigan is the HARA. The HARA is a service provider that is designated to ensure access to resources to assist homeless individuals. And it is contracted through the CoC through MOA and provides centralized intake and housing assessment. The state designation for the HARA really is about your housing choice vouchers and accessing your housing choice vouchers. But in nearly all Michigan communities, the HARA also operates the coordinated entry system because it does not make sense to have a centralized intake and housing assessment that does not operate your coordinated entry system. So the HARA is serving in that role as your coordinated entry lead in nearly every community. They participate in HMIS. They provide quarterly reports about the housing placements, and they work with all of your partner agencies to implement your coordinated entry system. You are required to have written standards for CoC programs. Most communities have more than one agency that is implementing the same type of program. So rapid rehousing, for example. If I am assigned to rapid rehousing program A, and the next person on the list is assigned to Rapid Rehousing Program B, we should be getting pretty much the same program unless there's a fundamental reason that we would be getting a different program, like I am a family and the other household is a single adult. But pretty much we want rapid rehousing to be rapid rehousing to be rapid rehousing, because clients are not selecting their rapid rehousing program that they want to work with. That is going through coordinated entry. So they should not get a different level of service or intervention if they go to program A than if they go to program B. Unless there is a specific reason for that. So your standards ensure that the programs within your system are operating consistently across the program model and consistently with the way that you want to work, like being low barrier and being housing first and being trauma informed, right? And implementing those best practices. That's where your written standards come in. So the CoC is required to develop written standards for all of your program types in conjunction with your ESG recipient. To make sure that there's consistent eligibility for who programs can serve. There's consistency in determining and prioritizing who the programs are going to serve for population, that they are getting their referrals from coordinated entry, that there is consistency about how much rental assistance for how long. For example, is your rapid rehousing program going to support people for 6 months, or is it going to support people for 24 months? Do they have to pay any portion of the rent during that time? Or is their rent fully covered? Right? Those are decisions that need to be made at the CoC level and implemented consistently across the agencies that you subcontract with these type of programs for. You are then, as the CoC, expected to monitor the performance of how those programs that you select for funding are working. So HUD monitors the CoC recipients and subrecipients because they are in a grantee relationship with HUD, even if they're a subrecipient, right? They are receiving federal funding. But when HUD monitors a program, they are really monitoring for things around grant compliance. They are monitoring for, are they only billing for eligible expenses? Are they documenting client eligibility the right way? Are they drawing down in the way that they're supposed to and spending at a reasonable rate, right? They are not looking at program performance. The CoC is expected to develop performance targets for what programs should be, who should they be serving and how effectively should they be serving them? Like how many people should be served by a program? How many of those people should exit to permanent housing, right? You as a community are supposed to define that for what you want it to be. So for example, you might say that you want 85% of your rapid rehousing clients to exit to permanent housing, right? That's a reasonable goal for rapid rehousing. And then you have to look at your rapid rehousing programs and see, are they doing that? And if they're not, how do you work to improve their performance? If you are not doing that, eventually you will see negative impacts on your system performance rating from HUD. If you are funding the same projects over and over and over again without making any adjustments or changes, eventually they will realize, particularly if you have some poor performers, that you are not effectively making decisions based on performance monitoring. In the last NOFO round, a lot of my communities were genuinely surprised by how much lower their score was in this section of their NOFO. And that was really because HUD did not see any demonstration that they were monitoring programs for performance and making changes or trying to get programs to make improvements on their performance. And so they scored much lower than they had in previous years. The next bucket of responsibilities is system planning. And this really, to me, is the bucket that is about the purpose of the CoC, right? The purpose of the CoC is coordinating and implementing a comprehensive system to address the needs of the homeless population and all of the subpopulations within your community, right? And you don't know if you are doing that well or effectively unless you are being strategic and doing some specific planning around that. And this is really the area where going back to when I talked about you can check all the boxes, but not really live into the spirit of what the intention behind the CoC regulations are, this is really where I see that happening a lot. HUD requires that your community do an annual systems gaps analysis, right? You are required to conduct to do an annual process where you are looking at the needs of people experiencing homelessness in your community and the services that you have available, and are those matching up, right? Are the services meeting the needs? Where are the gaps? Where are you falling short, either because services don't exist or because they are not effectively meeting people's needs? I generally suggest that this is something that is done sort of cyclical, meaning like maybe you might have a year or two where this is pretty much a data-based analysis. And then every couple of years, it is a much more intensive analysis with a lot of both quantitative and qualitative data, talking to providers, talking to people experiencing homelessness, and really doing a more in-depth gaps analysis to really drive strategic planning. But you can do an annual gaps analysis every year and check the box that you did it and not have it go anywhere or do anything, or you don't make any changes in your system based on that, right? That's not the intention, but you certainly can do that and check the box. But you're not getting anything out of that if you're not using that process to make informed decisions about who are you funding, how are you funding them, what are your priorities, what changes do you want to make. You are required to conduct an annual point in time count. The point in time count is a true point in time. It is a single night in January. Has to be in the last 10 days of January. You are required to submit a sheltered count every year, which is usually something that nobody even really knows is happening because it lives completely in HMIS, where they are pulling out all of the numbers of people that are in all of your sheltered programs on the specific night that is designated. Every other year, you are required to do an unsheltered count in the odd numbered years. So next January in 2025, sometime in the last 10 days of January, you will have to do your point in time count for people who are unsheltered. How you do that is totally up to you. I have been involved in point in time counts for years and years, and every community does it differently. Some communities do it during the day. The community that I live in selects a day, and every provider in the community on that day hosts big events where they give things away, and they have haircuts, and they have clothing banks, and they have all food, and they bring everybody in and they do surveys with them, referencing where they slept the night before. The county that Seattle was in, where I worked for many years, on the night of our point in time count, we fanned out in teams of 3 people across all of King County in every census tract, and literally walked up and down the streets and counted people that we saw that appeared to be experiencing unsheltered homelessness. And then for the next week, if you went into a service provider, they asked you questions about where you were on Tuesday night, whatever night the count was, right? Where did you sleep? How long had you been sleeping there? So it was like a week-long process, but it referenced a single specific night, even though it took several days to get a representative sample. So how you conduct your count is totally up to you. You are required to consult with your ESG recipients. In your community, you have ESG that comes both into Genesee County and to the city of Flint directly. Those are both entitlement jurisdictions for ESG. ESG, remember, stands for Emergency Solutions Grant and funds many of the types of services that your CoC funding has. So in order to make sure that those funding sources are aligned, HUD requires that you work together with your ESG recipients to plan for how your ESG funds are going to be allocated across their services and interventions to ensure that it is consistent with how your CoC funds are being allocated, how you are going to report and evaluate performance of the recipients of ESG funding, how you are going to work together to make sure that both sets of funded programs are, utilizing coordinated entry. They are reaching the same performance standards, right? So many of the same requirements, nearly all of the same requirements that CoC funded programs have and CoC planning has, ESG has the same requirements, and they are required to work with you just like you are required to work with them. Okay, the next bucket of operations is data management. And as I mentioned, you have a statewide HMIS implementation. So you have a little less control over this than a typical CoC does, because you have agreed as a state to do it all consistently the same. So HMIS is the Homeless Management Information System. HUD mandates that every CoC utilize a computer database to collect client and project level information. As a CoC, generally you have the responsibility to select which HMIS system you are going to use. There are about 7 different ones available. You don't get to do that because MISTA has done that for you and selected the vendor that you are going to use, and serving at a statewide level as your primary HMIS lead, even though you have a local HMIS lead as well. So your local HMIS lead is Metro CDA. The HMIS lead is responsible to manage the HMIS system, to develop user agreements, and to receive the grant funds for HMIS. The CoC and the HMIS lead have to work together to develop, review, revise, and approve a privacy plan, a security plan, and a data quality plan for HMIS within your system, and that programs are consistently participating in HMIS in the way that they are supposed to do as a condition of receiving their funding. HMIS has client level data, has personal protected information in it. So privacy and security are centrally important. Data quality is very important because many decisions at both the local level, ideally, and definitely at the federal level, are made based on your HMIS data. So it is important that your data is as good as it can be. So the HMIS lead develops and monitors the policies and procedures for organizations to participate in HMIS, and enters into the end user agreement with the agencies that will be participating in HMIS and outlining their requirements of participation. Your HMIS lead is responsible for submission of your federal reporting requirements. So you have 4 annual reports that are due to HUD. They are due throughout the calendar year. Your system performance measures are due generally in the spring, usually March. Your LSA, we are in the LSA process right now. It goes from usually November to January. The PIT count happens in January and is usually due to HUD at the end of February, and the HIC corresponds with that. So your system performance measures are 7 system level measures that HUD requires that communities use to gauge their progress in preventing and ending homelessness. That provides you a complete picture of how well you are doing in your work. So the system performance measures are consistent across every one of the CoCs. The longitudinal systems analysis is a report that goes to HUD that has client level, not protected client level information, but client level information about how many people and who are the people that are implementing or accessing all of your programs, and how are they moving through your system. The LSA process is 3 months long because it is about cleaning up your data. It is about making sure that your data is accurate. When your first LSA report runs, it gives you a list, it gives your HMIS list a list of all of the errors and warnings in your data. And sometimes that can be numbers in the thousands. right? And so errors are things that cannot possibly be true in your data and indicate that there's a data quality issue. So for example, an error that might come up is you have a program that says that they served 5 people, but they served 10 households. That is not possible, right? Because every household has to have at least one person in it. So you can't have served fewer people than you served households. So we know that something is wrong in that data. And it is the responsibility of the HMIS lead to work to figure out where the source of that error is and to work with the program to fix it. So it is a back and forth iterative process. And so the HMIS lead will go to programs specifically to say, we've got to look at this data or that data. The other thing that the LSA tells us is errors, and errors or warnings. Sorry, that was errors or warnings. Warnings are things that are not probable, but are not impossible. So for example, we might get a warning that says, every person that was served in this program speaks Spanish as their primary language. In Flint, Michigan, that's probably not likely. So it will show up as an error. But if you're a program in Puerto Rico, that may very well be true. And so it just needs an explanation that we looked at our data, and this is in fact true that every single person that came to this program for this year spoke Spanish, right? And you just have to explain it to us. And it's really about making sure that your data is as accurate as possible. I already talked about what your point in time count is. The HIC goes with your point in time count. So it references the same night in January. The PIT tells you what the need is on that night. The HIC tells us what you had available to respond to that need on that same night. So how many units of shelter, how many units of rapid rehousing, how many units of permanent housing, right? Did you have to respond to the need that has been identified in the PIT count on a corresponding day? The LSA ties to the PIT and the HIC and your system performance measures. These all tie together. Because what happens is my firm, that's just a coincidence, my firm takes all of this data from every CoC in the country and creates the annual homeless assessment report, which is a 2-part report that is submitted to Congress. And it is the primary reason or the primary way that decisions are made about federal funding and allocations and formula allocations and the needs of homelessness across the country. So your individual client level data rolls up and becomes a nationwide federal report to Congress and the administration every year. So I referenced your system performance measures. The thing about the system performance measures that's important to understand is that they are designed so that they can be analyzed for the entire system, the program model, or the individual projects. So you can look at your system performance measures and let's just say length of time homeless. That's what we're going to look at for this particular, I'll tell you what they all are in a minute. You can look at that in your entire system, like across all of our projects. What is the average time that somebody experiences homelessness in our system, right? Is that where we want it to be? Do we want to work to make that shorter? But you can look at it the program. So you can say like in our shelters compared to unsheltered, right? Do our shelters, is their length of time homelessness less than people who aren't sheltered, right? So you can look at it across all your shelters or across all your rapid rehousing. That's really to say like, is this model of service working for our community and we want to continue to do it? Or you can look at the same thing for an individual project. So if I look at shelter A, do they have much longer times of lengths of time for people experiencing homelessness than shelter B does? Why is that? What's the difference? Is it shelter A is more effective? Is it that shelter B is serving a different population, right? So they are designed to be able to look consistently at all different levels so that you can be objectively making decisions about where you want to make your investments and how you want to organize your system. And so it allows for a coordinated way to measure progress towards ending homelessness across your system, across your state, across our entire country, because every community utilizes the same system performance measures. You can look at additional things beyond these 7, but you are required to have these 7. And then HUD uses your data through those reports that I just mentioned and scores your community on how you are doing on your system performance measures, and that is part of your score in the annual NOFO process that determines how much funding you get as a community. So the system performance measures are length of time persons experiencing homelessness, the extent to which people who exit homelessness to permanent housing return to homelessness. So this is rates of return after somebody exits to permanent housing. How many of those people return to homelessness? The total number of people experiencing homelessness, people who are enrolled in projects, what percentage of them have increased employment and income growth, how many people are experiencing homelessness for the first time. If you are a high performing community, which there are, I don't think any right now currently in the United States, they look at how many people are you keeping from falling into homelessness, but that really only applies if basically you've solved homelessness for everybody else. And then how many people are effectively transitioning into services from street outreach or retaining, obtaining and maintaining permanent housing through either rapid rehousing or permanent supported housing or some other permanent housing option. So ideally, you are using all of this data, right, to make decisions about your system. And they are really what is driving the decisions that you are making, because you understand the gaps. You know what your community needs, whether or not they're being met. You understand if there are racial or gender or other community-based or identity-based disparities that are happening in your services, and what can be done to fix that. You are making your system policies and priorities based on your data, and you are coordinating services to respond to people's housing needs, right? So your data and your system planning that I talked about really should be working together so that you are able to implement an effective system. And then the last responsibility is your funding application, right? This is how you pay for that. And ideally, the decisions that you are making in your funding application are a result of the system planning and the data analysis work that you are doing in the other buckets of responsibilities. So the CoC program NOFO comes out from HUD. This says every year. It has changed this year. It will be 2 years. So there will not be a NOFO in 2025. We'll see how long that lasts. There will be some minor process because HUD will allow you to make changes if you want to, or if they require you to, or if there's new funding available, for example. But you will not have to do a full NOFO in 2025. You can literally just check a box and say, we want everything to be exactly the same as 2024 if you want. The Notice of Funding Opportunity provides funding for eligible housing and service projects and provides funding for the CoC planning grant. The collaborative applicant, remember, is who submits the CoC consolidated application as part of the competition. And HUD sets its priorities through the NOFO process. A really great example of this is way back when I talked about your governing board. The HUD requires, I said, that your governing board have one person with lived experience on it, because that is what is in the interim rule. But over the years, HUD has really pushed that is entirely insufficient to be engaging with a single person to represent your entire homeless population, right, in a leadership capacity. And so a few years ago, I guess it's been 3 or 4 years now, HUD put a section in the NOFO application about engagement with persons with lived experience. And at first it wasn't worth any points, and then it's been worth progressively more points each cycle. What that section says is that you cannot get points for that section unless you outline multiple ways that you are engaging with persons with lived experience. And it further defines that you cannot get full points for that section if you are not engaging with persons with lived experience whose homelessness was 7 years ago or or less. Because a lot of communities, the reality is they had somebody on their board who had lived experience of homelessness many, many, many years ago and has worked at an agency since then, and really is representing a system role more than they are representing people who are currently experiencing homelessness in your system. You also cannot get full points in that section if you are not engaging with persons with experiencing unsheltered homelessness, right? So they have really pushed to raise the bar much higher than the interim rule of one person experiencing homelessness with no definition or no expectations of that person, to much more specific and defined engagement with persons with lived experience to receive points for that section of the NOFO. As the CoC, you are responsible for setting your local funding priorities, to have a process that is collaborative and transparent for the development of your applications, to approve your annual submission of your applications. The board is required to approve that before it goes into HUD through your collaborative applicant, who is the only one who actually can submit the application on your behalf. Your local funding priorities do not have to be a direct match for HUD's. Your score is probably a little better if they are, but it doesn't have to be. Transitional housing is a good example of that, right? HUD will not fund new transitional housing anymore, but there are some communities that are still funding and grandfathered in their old transitional housing and continue to have that as a priority in their funding, even though that is no longer HUD's priority. So you can make that choice, but it may impact your overall score. You are required to have a rating and ranking process where you review, rank, and tier all of the project applications received for services. So those are the specific projects that are applying for funding. You review, rate, and rank them and select which projects you want to prioritize for funding, which ones you want to put in tier 1, which is much more likely to be funded, which ones you want to put in tier 2, which is potentially at risk of not receiving funding if your overall CoC score is not high enough. So you have to have a process for rating and ranking that is objective, consistent, and is based on your CoC designated priorities, and you want to determine the extent to which each project addresses both your priorities and HUD's funding priorities. You can choose to reallocate funds to new projects whenever reallocation would improve outcomes and reduce homelessness in your community based on that data and that planning that you have done. You are required to publicly post the written procedures that describe the project level review and the rating and ranking process and your ultimate list of rated and ranked projects. Okay. Whew, that was a lot. We have 8 minutes left, which I know is not a ton of time to ask questions, but are there any other questions that have come up in the chat or other questions that you have based on the massive amount of information that I just dumped on you?
Just thank you for doing this for us, Dusty. We certainly appreciate it, especially with your not feeling well, and being able to rally for a 90-minute presentation is very impressive. So thank you so much.
You're very welcome. Kevin, I see your question about the system performance measures. Let me pull up a link and I'll drop it for you right in the chat. I will also give these slides to Greater Flint Health Coalition and they'll distribute them. But here is where you find the information on system performance measures, right there. Any other questions? So the last thing I'll say then is that my primary responsibility as your technical assistance provider is support for the CoC. like I said, that predominantly looks like, working with your staff, right, through your infrastructure organization. I've worked a lot with your board, but that also means that as individual programs or members of the CoC, if you have questions about, implementation of your type of program or best practices or things like that, those are also things that I can help you with. If the need that you identify is bigger than like something like this that I can put together and do for you in the few hours a month that I have available to me. We also can look, as a CoC, you have the option to ask HUD for additional technical assistance time. It's fairly easy to get an additional 32 hours for a specific type of project that you have. So say, for example, you want to look at, better housing problem solving in shelter, or changes to your assessment, right? That's going to take more than 32 hours, but you can ask HUD for additional time, and a 32-hour additional TA allocation is relatively easy to get. And then if we start that and it's actually a much bigger project, we can then ask for additional time on top of that, which is a little bit harder process, and involves a little more begging and pleading from HUD. But so far, I have never had them deny a request that we've made, a community and I have made together. So if there are things that you think of that would be helpful to you within your system, you can communicate those to the staff at Greater Flint Health Coalition or to the members of your executive committee, all of which are routinely in touch with me. So thank you so much for your time and attention today. And I look forward to continuing the opportunity to work with your community.
Thank you so much, Dusty. Thank you all for joining us this afternoon. We wish you all the very best of weekends, and the recording will be placed on Greater